Joining us now, Director of the American Nurses Association Center for Ethics and Human Rights, Liz Stokes. Liz, thank you so much. Tell us, how is there any way possible at this point to help nurses and healthcare professionals who are putting themselves out there? They're exposed in every way, without the supplies, without the PPE, but even sometimes with them, they are exposed, are they not?
Yes, absolutely. And that is the biggest challenge. These are incredibly difficult decisions. So just imagine if you are a registered nurse and you have to decide each day whether you're going to go in and fulfill your professional obligation, which is outlined in our Code of Ethics. And this is a time when we're desperately needed. So whether you go to work and fulfill that obligation, or whether you sacrifice and risk your own personal safety, maybe even your life or the lives of your family and those close to you, simply because you don't have the adequate equipment to keep you safe, it's incredibly heart-wrenching.
Hey, Liz, it's Willie Guy. So grateful to have you on this morning. I've been talking to a lot of doctors inside ERs, particularly in New York City, and the first thing they say is the nurses, the nurses. The nurses deserve hazard pay. That what the nurses are doing in these ERs and ICUs is incredible. And it goes beyond what they're normally asked to do. As we heard that clip coming in, they're being asked not just to provide medical care, but emotional support for those dying who can't have their families. In some ways, they're acting as priests and rabbis, because those who are sick in those rooms cannot be with their families. Can you talk about the emotional toll that takes on our nurses in this country?
Absolutely. And one of the things that I keep thinking about is the psychological toll is going to be the next pandemic. The psychological toll on the healthcare workers who are witnessing massive amounts of death, massive amounts of grief and sorrow every single day is almost like wartime. And we're expecting that many nurses are going to suffer from PTSD, moral distress, and burnout. And it is critical that organizations are being proactive at this time to help mitigate and alleviate some of these symptoms.
Yeah, and that's a difficult thing to do when you're in the trenches in the middle of all this. As we talk about to politicians about getting help into these hospitals, we hear hospitalizations are down in New York City, for example. We hear that the PPE situation is better in many of these hospitals. But as you sit here with us this morning, Liz, what do your nurses need right now? What's still out there that every day they reach out to you and say, hey, we need this?
We are hearing from nurses kind of across the spectrum. So we're hearing from nurses who are gung-ho, they're on autopilot, they're out there, they're ready, they're taking care of the patients. And then we hear from nurses who are doing the same but are truly suffering. And every single day is an emotional challenge. And they're scared to go home, they're scared to expose their family members. And then we're hearing from nurses who are saying, it's not worth my personal risk. And they're quitting their job. They don't want to expose their family. I've heard from nurses who are pregnant, or nurses who have young children or elderly family members in their home, and they are absolutely, they feel like it's not worth the risk. And then, of course, as you just reported, there are nurses who are dying, and this is incredibly tragic.
Liz Stokes, thank you so much for joining us. She is director of the American Nurses Association's Center for Ethics and Human Rights. Another